look, it's brain technology. I mean, at the end of the day, right? This is what. Don't you think there's a massive ethical question mark sort of placed and privacy of basically meddling with people's brains?
There's a huge amount of responsibility when you build a brain implant to put in another person's brain.
I mean, yes.
Yeah, absolutely.
Your brain controls everything.
What are the things that you owe a person if you're giving them a brain implant? Safety, first and foremost. You need to make sure that the surgical operation to place the device is safe, that the device itself is safe. Durability. You want to make sure that if you're putting a device in someone's brain, that you're making a durable commitment to them, that device will still function the way it did on day one, on day 1,000.
Yeah.
And then the other thing is like performance. You should build them the best possible system that delivers according to their needs.
Yeah. You're a doctor, okay?
I'm a PhD.
You're a PhD. Yeah, you have a doctorate. You're a doctor.
Doctor of philosophy.
I mean, I called you Matt, but I can call you Dr. Matt. But regardless, trust is everything. If it's a family member and I've got $150,000 like lying away and I want to help one of my family members, I have to have tremendous amount of trust to give that individual over to someone like in your company to have that brain implant. I mean, how do you build trust with your customer base?
I mean, part of it is transparency. Explaining what we're doing, why we're doing it, publishing about the technology that we're building, whether it's publishing our preclinical studies as we have done, or publishing the results of clinical trials. I think transparency builds trust.
What do you think what's the biggest misconception about what you do?
I think that people over-index on some of the far future aspects of BCI, which can become a little bit dystopian. And sometimes they underappreciate the things that BCI can deliver, in the next 5 years for people with certainty.
Give me a little known fact about brain technology. What people don't
there
really
are people who are completely paralyzed that are speaking with their family members again through brain implants. A lot of people don't realize that.
Wow. Do you know any?
Yeah.
I must know a lot.
Yeah. Actually, I received an email from one through his brain implant participant in a study at UC Davis. Sent him an email. He emailed me back through his brain implant.
And okay, so the email is like, it would look like any normal typical email. There's no sort of disclaimer saying this is coming from a brain implant. It will just be read like a normal
I think
standard
that's
email.
the idea. That's the goal, that we want to restore function so that people can re-enter society and go back to work.
Matt, this is amazing. I'm like, honestly, I'm genuinely blown away. But like I said right at the beginning, should I be scared of someone like you, or should I be very excited about someone like you?
I think one of the things is that
do you understand why I'm saying that? Because
absolutely, yeah.
I mean, you must get that a lot.
We see how developments in the smartphone and developments in social media haven't made us happier. Most people that I know,
the other way.
Most people I know aren't happier when they're looking at their phone. We have this, pervasive world of, push notifications that are constantly competing for attention, products where we think we're the users and we are actually like part of the product. So I think everyone should be, I don't want to say skeptical, but like society should be engaged in the development of the BCI industry. Yeah. There's so much good that it can do for people who need it. And even there's a future, a sort of science fiction-y, exciting, wild future where healthy people have brain implants and it's not dystopian.